Hi, my name is Taretha Cole. The nursing concern that I chose to do for this capstone project was patient falls related to quality improvement. Falls are a significant patient safety concern and challenge for healthcare personnel. Patient falls are one of the leading causes of injuries in hospitals and are considered to be one of the most expensive adverse events. Patient falls can cause significant injuries to patients that may result in an increased length of stay in the hospital, unanticipated surgeries, and possibly even death. Decreasing patient falls continues to be a challenge, which is why the implementation of beneficial quality improvement programs are needed. The QSIN competency that I chose was quality improvement. Hospitals use various quality improvement measures to try and help prevent patient falls in the hospital setting. Quality improvement measures are used to assist healthcare professionals in having the attitude that continuous quality improvement is necessary in everyday patient care. It is also very important that for quality improvement that nurses recognize that they are a part of the system of care and the care processes that affects the outcomes of patients. In 2009, the Centers for Medicare and Medicaid Services stopped paying for the care to treat certain preventable inpatient injuries that may occur during a hospital stay. These injuries would be things such as fractures, dislocations, and intracranial injuries that are usually due to patient falls. These events are considered never events. A never event is a preventable, serious, and costly error, that happens while being cared for in a healthcare facility that should never happen. Quality improvement programs are implemented to help prevent these never events from occurring. These quality improvement programs would include things such as fall assessments and various interventions from healthcare personnel to prevent patients from falling. All right, so just a little background on patient falls. Falls are a patient safety priority among hospitals. For adults in an inpatient hospital setting, rates for falls range from 1.2 to 25 falls per 1,000 patient days, which is actually quite high. Falls can cause substantial injuries to patients that could result in, like I said earlier, longer lengths of stay, unexpected surgeries, and sometimes even death. In the United States, patients that fall with injury, on average, stay an extra 6.3 days longer in the hospital than the length of stay for patients who do not fall. These falls are especially a big concern for older adults. A high percentage of the medical surgical inpatient population is aging and at a high risk for falls. There are many risk factors for falling, including age-related changes such as sensory alterations, muscle weakness, gait or balance issues, use of numerous prescription medications, alteration in activities of daily living, psychiatric issues, and also a history of falling. Patient falls not only affect the patients, but it also affects healthcare organizations. Patient falls are one of the leading causes of injuries in hospitals and also considered to be one of the most expensive adverse events. In 2014, the Centers for Medicare and Medicaid Services began to reduce Medicare payments to hospitals that scored in the top quarter for rates of harmful conditions experienced by patients during an inpatient hospitalization. In the United States, by the year 2020, the total number of patients that fall with a result of an injury is anticipated to be as high as 17,293,000 at an expense of $85.37 billion per year. The impact of patient falls on patients and healthcare organizations supports the need for quality improvement interventions that help to reduce the risk of falls, decrease the number of patient falls, and the severity of patient outcomes. For preferred nursing practice, there has been a lot of research done to determine what is the best practice in helping to prevent patient falls during hospitalization. One of the quality improvement programs that I found aids in reducing patient falls is a patient-specific fall prevention program. This fall prevention program should include a policy and procedure with a minimum set of standards, fall risk safety identification tools, a sample post-fall assessment, implementation of a stop-the-line concept when a fall does occur, hourly rounding tools, room observation forms, a decision-making algorithm for one-on-one sitter usage, education material for caregivers, patients, and significant others, a commitment standard for all healthcare providers, bed safety instructions, and a sample handoff communication tool. The implementation of this standardized fall prevention program has reduced falls with injuries by 58.3% over a 2-year period in the research that was performed. This quality improvement program also allowed for approximately $776,064 of cost avoidance in 2013 dollars. Along with this standardized fall prevention program, nurse staffing levels should also be appropriate in helping to reduce patient falls. Low nurse staffing levels has been shown to be associated negatively with inpatient injuries fall rates. Along with those two, also implementing a patient safety team that focuses on teamwork and communication helps to reduce inpatient fall rates. The fall safety team helps to raise situational awareness, increase mutual support, engage leaders, encourage open communication, and provide frontline staff education and involvement. Frontline staff would be the nurses. Implementing this patient safety team intervention has aided in reducing the likelihood of patient injury and has a prominent clinical influence on reducing inpatient falls. All of these quality improvement interventions together would be the strongest and most helpful preferred practice to implement in hopes of reducing patient fall rates. Education is also a big part of the quality improvement program. Staff education is an essential part of all quality improvement projects. Staff education is needed about all assessments and device usages that are implemented within the quality improvement programs. Falls prevention is largely influenced by nurses. Thus, it is very important that the frontline staff that will be implementing these interventions are thoroughly educated about all aspects of the programs. Staff should also be educated on providing education to caregivers, patients, and families on how to help prevent patient falls and the importance of preventing these falls. Overall, education is crucial in having successful quality improvement programs. There are further research priorities that should be done. Further research should actually always be done for continuous quality improvement and to better the improvement measures. With the quality improvement plan of implementing a fall prevention program with many interventions, the outcome was reducing patient falls, but there was no way to determine exactly which interventions were the most influential on reducing these fall rates. So further research using randomized controlled trials would be helpful in determining which interventions are the most beneficial. Further research overall will help to determine better interventions and strategies to help improve patient safety and reduce patient falls. In conclusion, patient falls are an important patient safety concern and continue to be a difficult challenge for healthcare organizations. There are many quality improvement programs to help reduce the risk of these patient falls. The research literature shows that implementing patient safety teams, standardized fall prevention programs, and improving nurse staffing levels will all aid in helping to reduce the rates of patient falls. Decreasing patient falls continues to be a challenge, though, even with quality improvement measures in place. So it would be helpful to consider further research in helping to decide what quality improvement programs work the best to help reduce these patient falls. Thank you.